Hi everyone, I'm here to review brain demonstration on stem cell is not as useful as the embryonic cell stem cell in the curing the disease. Therefore, my claim is the adult stem cell is still as useful as the embryonic stem cell today. Here are my three secondary crimes. The first secondary crime is the adult stem cells are not harmful by the normal and healthy adult life. And the secondary crime is the adult stem cell are as effective as same as the embryonic stem cell. And the third crime is the adult stem cell are easy to find, transplant, and storage. Alright, here is my first point. The adult stem cells are not harmed by the normal and healthy adult life. First, the large radiation mutation is required to turn the cell into cancers. So it is true that the sun radiation may cause skin cancers only if exposed under strong sunlight for a long time. And according to the CDC spreadsheet, there are several productions of sunburns and skin cancers. For example, using the sunscreen and wearing long clothes. And next is adult stem cells are the same chance of getting cancers than the other cells. According to Nicholas Wayne said, biologists are not yet sure how cancer stem cells are generated. It may be the stem cells themselves suffer from a mutation or change in the DNA structures. And the adult stem cell can be donated. The laboratory diagnosis can be taken to analyze the matching of the stem cell in order to maximize the rejections. And according to the National Bone Mutant Donate Program, the doctors look for donors who match the patient's tissue types, especially the HLA tissue types. The close match between the patient's HLA markers, that's the stem cell markers, and the donors, the better for the patient to avoid rejections. And my second point is the adult stem cells are durable as same as the embryonic stem cells. First, adult stem cells are widely used in the person than embryonic stem cell. And adult stem cells are used in stem cell therapy today. And according to the University of Utah, the Genetic Science Learning Center, that adult stem cells are used for bone marrow transplant and umbilical blood stem transplant, which can occur in blood cancer and spinal cord injuries. Besides, adult stem cells are likely to cause rejections. It's more safety to use in therapies. And according to the National Institution of Health, that adult stem cells and tissues differ from them are currently believed that less likely to cause rejection after transplantation by immune systems. This is because the patient uses his own stem cells. In addition, there is advantage experience on human stem cells than embryonic stem cells. The embryonic stem cell treatment was used on humans. The first time was just a month ago. And according to the LA Times, Dr. Robert Wiskin said, we have experience on rehabilitation, but we don't have experience on using the embryonic stem cell on treatments. And in contrast, human stem cells have been used for 14 years in transplantations, and they have advanced technology on collecting the cells and transfer the cells. And then my last point is adult stem cells are easy to use, easy to find, plantation and storage. And according to the National Institution of Health, the stem cell can be donated through the cord blood and bone marrow. There are several organizations such as National Marrow Donor Program and the International Cord Blood Society accept stem cell donation and storage. So based on my 3 points, which is the adult stem cells are not harmed by the normal and healthy life, and adult stem cells are effective as used as embryonic stem cells, and adult stem cells are easy to find, transplant, and storage. Therefore, my conclusion is human stem cell is still useful as the embryonic stem cell in the present. Thank you.
All right. Basically, you've got your structure and your supporting points outlined. You need to contrast them a little bit more with the claims being presented by the advocate. It sounds like it's a separate speech, that the points do counter the claims that were made by the advocate, but you need to remind us about how they apply to those particular points. The closest that you came to doing that, I thought, was on the first point where you talked about mutations and the risk of cancer in those particular cells, and you suggested that that's really, it requires a huge amount of exposure to radiation to get that cancer mutation that the advocate was talking about, and I thought that that was a pretty clear application. After that, it just seemed like you've got your counterclaims and you're presenting them, and I'm not getting a lot of contrast to the advocate's argument. You cite the evidence pretty consistently when you're presenting it. You need to tell us a little bit more about how your inference addresses the position that the advocate is taking. If we were hearing this speech immediately after the last speech, it would probably all be a lot clearer because everybody would remember exactly what the claims were of the advocate. But because we're hearing it a little bit later, we needed to have more of that contrast being provided. All right, thank you.